Paraffin wax bath therapy. Paraffin wax bath is a superficial heating modality which includes application of the molten paraffin wax over the body parts. The temperature of the paraffin wax is usually 40 to 44 degrees Celsius, whereas its melting point is 51 to 55 degrees Celsius. Some sort of purity, for example paraffin or mineral oil, is added to the molten wax to lower down its melting point, as 51 to 55 degrees Celsius molten wax, if poured on the body parts, may cause burns. Combination of paraffin and mineral oil enables the patient to tolerate the heat from the paraffin better than that from the water of the same temperature. The composition or the ratio of solid wax to liquid paraffin to petroleum jelly is 7 is to 3 is to 1. The mode of transmission of heat from the paraffin to the patient's skin is by the means of conduction. Let's see the method used in paraffin wax bath therapy. The part to be treated must be cleaned with soap and water. Moisture is to be soaked with towel. Position the patient such that the part to be treated comes closer to the wax bath container. Before application, one must ensure that there should be no moisture over the body tissue, otherwise, burns could occur. The warm wax is placed on the body tissues by various techniques, and the treatment is given for about 10 to 20 minutes. Let's keep this picture in mind, which is a diagram of the paraffin wax bath unit. So the paraffin wax bath unit comprises of the stainless steel container, mains, thermostat, thermostat pilot lamp, power pilot lamp, lead, and caster. Heating is quicker because there is no water jacket to be heated. So the function of the mains is to switch the heating element on or off. The thermostat is adjusted with the knob and keeps the temperature fixed or static. The thermostat pilot lamp indicates whether the thermostat is on or off. The power pilot lamp shows whether the power is on or off. The lead and the caster allows the container to be moved from one place to another. Techniques of application. The first one is the direct pouring method. The molten wax is directly poured by a mug or a utensil on the body part and then wrapped around by a towel. The wax is allowed to solidify for 10 to 12 minutes. 4 to 6 layers can be made over the body tissues. The second technique is the brushing method. Brushes of various sizes, that is 4 inches or 6 inches, is used. Several coats, that is 4 to 6 layers, are applied over the body tissues, and the wax is allowed to solidify and wrapped over by a towel. The third technique is direct immersion or the dipping method. The body part to be treated is directly immersed into the container of the paraffin wax and taken out. Once the wax solidifies, the part is again immersed to make another layer and wrapped around by a towel. This method is preferably used for treating distal body parts. The fourth technique is toweling or the bandaging method. A towel or a bandage roll is immersed in molten paraffin wax and then wrapped around the body part. Several layers can be made. This method is used for treating proximal body parts. Regular cleaning or changing of the wax is necessary to ensure good hygiene. Effects and uses of paraffin wax bath. It provides superficial heating to the tissues. It increases local circulation to the area. It increases the pliability of the skin and reduces stiffness and pain. Indications of paraffin wax. It is used in rheumatoid arthritis, osteoarthritis, joint stiffness, adhesions, post immobilization stiffness, and scars on the skin. Contraindications of paraffin wax bath includes open wounds, skin rashes, allergic conditions, impaired skin sensation, and defective arterial supply. Maintenance of paraffin wax bath unit. Sterile the paraffin wax bath by heating it to 212 degree Fahrenheit. For reuse, sterilization should be done frequently. Drain the melted paraffin wax, filter it out, and replace it back for reuse. Change the wax at least once in 6 months. Proforma for patient's assessment. Receiving the patient, knowing the details about the condition, preparation of test tubes, one with cold water and one with hot water, arrange pillows, towels, sandbags, preparation of the apparatus, temperature of the wax should be checked. Preparation of the patient, the nature of the wax treatment is explained. Area to be treated is cleaned and soaked with towel. Any moisture on the area needs to be removed to avoid burning. The body part to be treated should be placed in close proximity to the wax bath container. To test the skin sensations, two test tubes are used, one with hot and the other with cold water. The part to be treated needs to be checked for its intact sensation before the treatment.